to be back. It has been a while since we did one. And I'm really happy to be here and support ADD Resources. I think you do great things for the ADHD community, online and offline. And so I'm happy to contribute and hopefully serve your members tonight. So when we talked about the topic and talked about medication, you said, lots of people are interested and it's always a hot topic. I was thinking about what I could do that would be helpful to people who are new to medicine, helpful to people who are familiar with medicine, and some updates and that sort of thing. So I've created a new presentation. This is not material I've done before, and I'm trying to meet the needs as I stated them, and hopefully talk for about 35 to 40 minutes and then leave time for question and answer. And if we have lots of questions, I'd be happy to answer lots of questions. If we don't have lots of questions, I can either, expand a little more on some of the ideas, talk about other things, or, I'll leave that to you, Kathy. So, but I don't want to, I could talk for 2 hours about this, but I want to make sure to leave enough time for members listening to be able to submit questions. And I do have a little bit of a thing in my throat, so I may, a little tickle in my throat. I may mute myself for a couple seconds here and there just to cough. So 1 sec. Okay, excuse me. All right, so for our overview tonight, we'll have a brief introduction. I'm going to talk about how to think about ADHD medication. And really, this comes out of material that I've been teaching doctors. Because when I do my consultations for ADHD, of course, I'm looking at all aspects of ADHD when I'm doing my consultations and assessments. And when it comes to the medication part of it, I have a specific way that I think about it. And I'd like to help you to think in that way because I think it'll help you out in a significant way. So the concept of 4 medicines. And then we'll talk about starting treatment and fine-tuning treatment so that depending on where you're at when it comes to medication, hopefully I have some advice to help you out. Then I wanted to talk about ADHD medication in the news. I thought we had a lot of news going on several years ago when I first started online blogging and sharing information and that sort of thing, but it has really exploded in the past year. There are major issues with shortages of medications in pharmacies right now across the U.S., and there's the whole Ritalin gone wrong controversy, and I'd like to share some thoughts and arguments about that with you tonight. Because of the fact that there's so much stigma, there's so much misinformation, that you need to have solid facts. When somebody's coming at you with passionate and sometimes ignorant information, it's important for you not only to come back with passionate, correct information, but also to have some facts behind it. So I'm going to share some arguments you can use if anybody actually knows enough about this Ritalin gone wrong controversy, or maybe I'll just help to reassure you that there is science behind medications and the arguments put forward in that New York Times article are not as solid as they would seem to be, according to the author of the article. So Kathy gave me a wonderful introduction. I'm Dr. Kenny Handelman. There's a picture of me there. She was kind enough to mention my book, and I'm thrilled you sell it in your store. That's wonderful. And I like to look at differences rather than deficits. The concept being a strength-based approach. And although, technically there are deficits, technically ADHD is a disorder and it causes problems in people's lives, I feel that if we focus on differences and keep a strength-based approach, we can help people in a whole other way, and it's not quite so negative and challenging for them or their family when they view it differently. Now, I do want to mention I am based in Canada. Kathy mentioned that in the introduction. I'm based just outside of Toronto, and so that's important from the perspective that some of the things I'm going to be teaching will be relevant to the Americans on the line, and some of it will not be relevant to the non-Americans. So, for example, the medication shortage is an issue in the U.S. right now, and not in other countries. Also, when I talk about medication, Intuniv is in the U.S., and that's the only country it's in right now. Now, I'm certainly aware of what's going on internationally with ADHD in many ways, and I'll do my best to fine-tune this, so whether you're listening in from the US or Canada or somewhere else, hopefully this can still help you out.